I'm very glad to be invited here to participate in this exchange program for mental health specialists, because here we can see a lot of well done practices, very elaborated, and as I understood, kind of a educational policy in Croatia has happened at the same time in Bulgaria. In 2017 was accepted the um, inclusive education program in many schools, so I can see very well established practices both at school, in social sphere, and in mental health. And I can see also something that I was really, and I am really inspired, is the system of mental health. It is a decentralized system, I can say, with a lot of well-working hospitals, with many specialists, and something that I can observe and also is mentioned by people, that there is a law system, a law, national law for different specialists, even for psychotherapy specialists, which I think is important, to some limits to be set in order the market, the specialists to be open and to have some kind of professional requirements, and of course professional help for people with any kind of disability. So I am really inspired to see many young people who are working with smiling people, not with a lot of stress and burnout. And I really enjoy here being here, and I hope that it will be very helpful for me to spread this mood also to my colleagues in Bulgaria, and do hope that we can learn a lot from practice in Croatia. Personally, I'm interested, I have a kind of profile method of working, which is psychoanalytical field. And this is helpful when we discuss different cases here. So we exchange some views according to different perspectives of people who are from with different backgrounds, professional, I can say, background. So it's good to discuss different cases. As today we visited a very interesting center for professional rehabilitation center. We communicated with young people who are learned how to acquire certain professional skills. So I think it was helpful, as well as yesterday we met with some patients at the hospital. So it was also for me an interesting way to communicate with them. Croatia is a very beautiful country. We have a very heavy, intensive program, I think. Visited some of the main, I can say, interesting places in Croatia, Plitvičke jezera, means Plitvičke lakes, which is, I think, like a paradise, natural phenomenon with a lot of waterfalls. We visited also Croatian coast, Opatija, a small historically town, I think, and I know that there are many interesting museums, for example, of the broken relationship in Zagreb, and as well as hanging over. So I think it's connected with mental health, and I'm going to visit maybe them today. So I'm in a hurry. Oh yeah, definitely. I think it's worth going to such visits, because mental health is a special professional field that people should, and they need to meet different methods of working practices in order to be inspired. Otherwise, it's a different field of working with pathology, so I think it's very important to keep the dynamics among people.